Okay, so if you drink Diet Coke or have eaten other low-sugar foods lately, you've likely consumed aspartame or any kind of sugar substitute, but specifically aspartame is the target of a World Health Organization study. They are set to announce that this could be, quote, a possible carcinogen to humans. Reuters reports the announcement could formally come down July 14th from the International Agency for Research on Cancer. NewsNation medical contributor Dr. Dave Montgomery is here. Dr. Dave, I have a personal story. I have a friend, 25 years ago, she was like in her 20s. She went to a doctor, she had polyps, and the doctor said she was at heightened risk for colon cancer and to never drink anything with aspartame in it, no diet soda. I know that's one doctor, but if you go online, you can find stuff from people who say it's not good for us. Why has it taken so long for the World Health Organization and the greater medical community to actually announce this?
Yeah. Good morning to you, Adrienne. I think this is on the minds of everybody. Why are we relitigating, this case again? It turns out that there was a large study in France. 100,000 people were surveyed about non-nutritive sweetener consumption. And this is an epidemiologic study. So this is really important, Adrienne, for us to point out for people. Epidemiologic studies are association studies. That means we cast a broad net, see what comes back, right? These are about trends. This is not a cause and effect study. And for the first time in a decade or so, there was this large study now that brought up the idea that there may be, as the authors say, a slight increase in cancer. But I looked at this really, really carefully because association casting a broad net, what else was in the net when it came back? Well, it turned out the people who had the higher risk of cancer also had the highest intake of ultra-processed foods. They were also far and away the more likely to be smokers and the least likely to consume fiber, fruit, and vegetables. So again, we casted this broad net. It doesn't mean that the non-nutritive sweeteners, there were 6 of them, cause cancer. That just means there was an association here. We have to be careful with this.
I think that's a very important note, and I'm glad you cleared that up because obviously if you take these sweeteners, you may have other unhealthy habits like the study found. At the same time, I think there are a lot of people who feel the government standard for what is safe is not. So I'm curious to know, as medical professionals, if the FDA says something is safe or if it says something is bad, are doctors encouraged to just promote the FDA's findings whether or not there are conflicting studies, as there have been for years about aspartame?
No, the idea of impropriety. I'm getting messages and DMs about that all the time. Listen, I said, on our air with Cuomo that I am going to stick with the FDA. The FDA are a group of my colleagues, scientists and physicians who are just waiting for something to be wrong, for them to pounce on it. And the FDA has been really clear about this. Things like aspartame are safe in the amounts, the allowable amounts, acceptable amounts that we might consume. And there was one report that said you'd have to eat 75 packets of the tabletop sweetener to get to the acceptable daily limit, right? Let alone some sort of carcinogen. I do want to point this last part out. This is really important. Even the AIRC, the cancer arm of the WHO, is saying that they don't really think that this causes cancer because there's 4 classifications. Carcinogenic, probably carcinogenic, possibly carcinogenic. And for lay people, hey, it's possibly carcinogenic. You think that it has something to do with the toxicity, and it doesn't. It has to do with the level of evidence. And when it's the second to last, possibly carcinogenic, what they are saying is we don't have evidence in humans enough to support a claim of carcinogen, and we barely have sufficient evidence in animals. We've got to take this into context and go with the FDA on this one.
I think that, like you said, you mentioned, you'd have to consume so much, but I know people who put like 6 packets of Equal in their coffee. If you do that over a certain amount of years, there could be some concerns. According to this data, really, when you think about the lifestyle effects and the whatever those big words that you used earlier, study, really quickly, should people stop eating aspartame? We only have a few seconds left.
Here's what I tell people to do. If you have a risk for cancer, don't overconsume any sweetener because we know that sugar and non-nutritive sweeteners are just not going to be the way to go. And if you don't know your risk for cancer, go hire a doctor right now expressly about getting your risk for cancer and, getting the testing done for risk for cancer.
I would love to have a longer conversation with you. I think there are plenty of studies that show that sugar substitutes do the same thing chemically in the body as regular sugar does, and that's a reason why some people should be concerned. But we can talk longer later because we're out of time. You're amazing. We love having you on, Dr. Dave. Thank you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.